Oral hygiene is important whatever your age, but as we know that 78% of mouth cancers are now occurring in the over 55s, it is really important that care home residents are looking after their mouths and care staff are looking out for the signs and symptoms of mouth cancers. Regular assessments of the resident's oral cavity is really important. The ideal time to do this is when you are brushing or caring for your resident's teeth or dentures. If your resident is comfortable with you performing their oral care, this is the time to have a look in the mouth and see if there's been any changes by asking them to stick their tongue out, looking under the tongue, if they're able to, into both cheeks. When looking in the mouth, it's a good idea to have a pen torch. You're looking out for an ulcer that maybe hasn't healed over 3 weeks, tooth that maybe is unexpectedly loose, maybe an odour as well, or the denture isn't fitting correctly. Once you've done that, have a look at the face, have a look at the skin. Are there any bumps, any lumps that have appeared, or any moles that have changed shape or colour? This is the time to make a record of this. Now we know that providing oral hygiene care and performing these oral checks might not be straightforward. Some residents have some complex needs. We do know that nearly 58% of people in residential homes have got dementia. In these cases, we encourage staff, relatives and loved ones to use the look, listen and observe method. You know your resident. Look out for any subtle changes. Is there an odour coming from the mouth? Is the resident drooling all of a sudden? Are they losing weight? Listen to their voice. Is it hoarse all of a sudden, or are they complaining they've got something stuck in their throat? Always look. Are there any lumps or bumps evident around the jaw or around the mouth? Any moles changing at all? These are all signs of a potential problem inside the mouth. In situations where the resident can be a little bit reluctant to have oral care provided or an oral assessment, we can either try at a different time of the day maybe, or look at some of the distraction techniques which are really helpful. Meal times are a great opportunity to look, listen and observe your resident. If they're struggling to eat or drink, this needs documenting and raising with the senior person in charge.